This is Sarah Squires bringing you behind the headlines in today's edition of WYO Today Newsroom. Today, I am so fortunate to be joined here in the studio by Tisha Tuttle. She's with Wyoming Senior Citizens Inc. Welcome to the show, Tisha.
Awesome. Thank you for having me. It's a pleasure to be here.
Now, I know you really have got a lot of updates for us and things that we should be paying attention to for our senior populations and folks who are kind of keeping an eye on changes at the federal level that impact us here in Wyoming as well. And I wanted to kind of kick it off here, Tisha, by getting kind of your update, what we should be thinking about when it comes to the pressure that's on these Medicare premiums and the real concerns out there.
Absolutely. There's a lot of projections and speculations out there, but a lot of those projections currently are leading towards those Medicare premiums almost doubling over the next decade. Mm-hmm. And anybody that's on Medicare now is already kind of gobsmacked. When you're on a fixed income, every penny counts. Mm-hmm. And what we're seeing is those projections doubling faster than the cost of living adjustments. So for our seniors that are on Social Security or retirement benefits, where that fixed income only changes when the government allows it, mm-hmm. the cost of living adjustment. For reference, the Social Security cost of living adjustment in 2026 was 2.8%, mm-hmm. meaning that our beneficiaries got a 2.8% increase. That sounds amazing, sounds incredible, until you realize that the Medicare premium went up by almost 10%. Mm. So you give a little, you take a lot. And for those beneficiaries that are on Medicare, that really can be an impact. And knowing that the future may hold a bigger increase is something we absolutely want to keep our eye on and tell our legislators how we feel about it and what can we do to negate that. A lot of my work is helping people understand what that is, how to negate those. Can we qualify for those Medicare savings programs? So our coordinators around the state help people find ways to afford those if available. The other things that we look at is what is causing that increase? What are we seeing as far as those trends? And a lot of that can boil down to or can be because of overpayments to Medicare Advantage plans, to drug companies, and a lot of those costs associated with insurance and medical care. So can you talk about what seniors should expect when it comes to these issues? Absolutely. I think the best thing that they could do or to expect is there's going to be cost increases unless there is a change in our insurance world as we know it. So anticipate some of those maybe expenses going up and find out if you can qualify for some of those Medicare savings programs or assistance programs around our state. Giving our office a call and getting an appointment with some of our coordinators now or anytime you're kind of feeling that financial pinch. Mm. Well, we're so lucky here to have you as our kind of local expert, Tisha, and, you know, the crew at Wyoming Senior Citizens Inc. in general, keeping an eye on some of these issues. And we know that things are on pace to, you know, rise dramatically, you know, within not too many years from now. And, you know, we've got a lot of pressure on Social Security. And so it's definitely something that, you know, we can't wait until it's an even more dire emergency before we sort of lock in and say, gosh, it's time to kind of get in there and start tightening up some nuts and bolts and figuring out how to fix our system entirely. For folks who are currently on Medicare Advantage, what are some things that they should be paying attention to now? I know there's a lot of dates that kind of go into the formula, and we really need to mark our calendars, make sure we're on top of that. Absolutely. If our Medicare beneficiaries started the year January 1st of 2026 or have been into an Advantage plan at the beginning of this year, you have until the end of March 31st, to change that, whether you want to go back to original Medicare, whether you want to switch into a different Advantage plan, should there be one available, you can do that before March 31st. It is called the Medicare Advantage Open Enrollment Period. And it's only for those beneficiaries that started the year in that Advantage plan.
Well, March 31st is sure creeping up on us soon here, Tisha. So what would you recommend? I'm looking for a phone number here. But if folks have questions and they're thinking, oh gosh, I think that's me. I don't have very much time left. Who should they call?
Absolutely. Ghostbusters doesn't do much with Medicare, but we do. Give us a call, 307-856-6880. And one of our counselors would be happy to help you with that Medicare Advantage open enrollment period. Our Riverton office is myself, Tish Tuttle, or our other counselor, Joanna Stortrin. And in Cheyenne, we have Misty Lamb, and Casper is Peggy Darling. We'd be happy to help.
Oh, darlings, Hugh. All the whole crew there definitely are earning those paychecks with helping us out with so much complicated red tape, you guys. I mean, it's hard to recognize all the things that you really need to stay on top of. But luckily, we've got local folks here who can help you out and make sure that you don't miss a deadline, that you know kind of what's coming down the pike and what you need to stay on top of. Now, one of the things I was hoping you could kind of unpack for us, it really has to do with Wyoming-specific changes and kind of risks and what's going on here with Medicaid.
Absolutely. So our Wyoming lawmakers had passed a plan to use some of those rural health funds, and they've kind of started not spending it out, but outlining where that's going to impact. A lot of them currently is targeted towards rural hospitals, EMS services, workforce training, and physician education, bettering our smaller rural hospitals. What's crazy in Wyoming is our most towns, cities, and locations are not even considered rural. Rural in Wyoming is actually, in most cases, classified as Casper or Cheyenne. The rest of us are frontier. So the impact of a lot of these things can be huge for even our smaller spaces and where we get sent. 9 times out of 10, if you live somewhere in Wyoming, you are getting life-flighted to Casper, Cheyenne, Denver, or Billings. So those funds can be monumental. Now, Wyoming lawmakers have passed that, but it has not yet been approved at a federal level. All of the government is still kind of in that hem-haw state of passing that budget bill. That federal rural health benefit is part of that big bill that they're waiting on passing. So if it's not passed at that federal level, Wyoming will have to go into a special legislative session to rewrite some of those plans.
Yeah. So we know that as part of the Big Beautiful Bill Act, there's $205 million in federal rural health funds coming to Wyoming. It's a kind of a short-term pot of money here, but the federal government has to approve what we're going to use those funds for. And of course, a lot of work was done on the front end in sort of exploring what are some of the most crucial issues, that we're facing here when it comes to healthcare coverage and healthcare in general in Wyoming. And I noticed it seems like there's just a line out the door now, people thinking, hey, well, maybe we could use it for this and this and this. And so absolutely a lot of need out there. If anything, I think that's what's really, really demonstrated by this. And we don't know how it's going to shake out.
Yeah, they have this great plan. And I think the anticipation of those funds is absolutely exciting. It's a matter of which layer of importance are we going to address first? And that's critical. So we'll kind of wait to see how that one pans out, but it is something that absolutely everybody should be aware of and advocate for, and knowing what services are available when, which one has your governor or has our state identified as critical. And educate yourselves if you're in a facility or whatnot that could benefit from those funds on how do we apply for them. Again, it hasn't been approved at the federal level, but it's something you want to keep your ear on.
Definitely. one thing I don't know if I have explained to you in the past, Tish, is that I spent years when I was younger working in nursing homes as a nursing assistant. And so sometimes, there's changes in the law, changes in regulations that impact nursing homes and skilled nursing facilities in general. And a lot of times when it comes to those minimum staffing levels, I always kind of get my hackles up a little bit because, that's really hard work. And I remember, 25 years ago, I always felt short-staffed, even when we were probably higher staffed than what the minimum staffing requirements are now in some places. But I've heard some kind of rumblings and some concerns about there regarding Medicaid reimbursements for nursing homes and those kinds of facilities. And I'm wondering if you can kind of fill us in on what's going on.
Yeah, so with my ear on the ground, they had a bill that was proposed to increase their reimbursement at the nursing home level, and that failed for Medicaid reimbursement to reimburse at a higher level at those long-term care type facilities. So that can impact in closures, staffing shortages, limited beds for long-term care because you can't have more people than you have staff, kind of like a classroom.
Yeah.
You can't have more students per teacher. So that is huge as far as how that can impact our already struggling long-term care facilities when it comes to income. What happens more often than not is those residents will be living there and their rent might increase, and Medicaid is only covering X amount of dollars. And in order to qualify for that, they've had to spend down or had low income. They no longer have those cash assets to subsidize that. And so sometimes they will no longer qualify to live at those long-term care facilities. Mm-hmm. And so for a beneficiary or for somebody that's in that situation, if your grandparents were in the long-term care facility, their rent gets increased and they can no longer afford it, you now have to figure out how to take care day to day your loved one, mm-hmm. if they can no longer afford to stay in those centers. And that can be a huge impact for families, for the beneficiaries in that situation, and for those facilities and the staff that work there, in all honesty.
Mm. Yeah, a lot of pressures on that system too. I mean, you just kind of look at the population projections and think, gosh, where are all the workers going to come from, when we need them for these kinds of services? And so it's interesting to sort of add up some of the different pressures that are built into the system and maybe ways we can sort of pull the relief valve somewhere along that line too. Now, Tisha, I'm wondering if you can talk a little bit about Social Security. When we're looking at Social Security, whether it's tax relief, maybe some increases down the road, what are we looking at?
Well, Social Security isn't normally my strong suit, but I've had my ear on this pipeline as these things are kind of passing and going through and bills and whatnot. And they have some massive tax breaks for our seniors. Most seniors will not pay federal taxes on their Social Security income. And about 88% of our seniors nationwide could be benefiting from that. So they might not be saving you a bunch of money, but when it comes to the costs of Medicare, but not having to pay those taxes if our seniors are filing taxes can be a huge impact.
So what are some things that we should be taking away when it comes to, some of these issues that we've gone over when it comes to Wyoming, like right here at home on the ground?
Yeah, I think some key takeaways from our conversation today is maintaining your access to care, that rural health care. That's something that you can advocate for by calling your local representatives. If you have questions, feel free to reach out to those local representatives on what's going on with rural health care in your area. Long-term care, if you have a family member in that type of facility, if you have a loved one that are planning to do that, take a look at our financial situations and really evaluate that 5 to 10 years for that family member if you're able, or yourself, and identify what that looks like for those individuals. Seniors are getting tax relief. That I think is huge, getting that that tax break, that might be a great way to kind of stock up and save for those Medicare premiums that might be going up later. So when that comes, I think the biggest level of importance is watch your pocketbook and find any way to save. Stay abreast on what's happening on the federal level that can impact us here in Wyoming. One small ripple can cause a great big wave. And we're pretty far from the ocean, but that doesn't leave us out of the woods. So staying abreast on those changes, making sure you know your enrollment dates, and of course, knowing who you can call to find out more at Wyoming Senior Citizens Inc., your SHIP coordinators at 307-856-6880.
Well, absolutely some good advice and some things to really keep in mind and sort of monitor. If you want to weigh in with your local, state, federal legislators on some of these pieces and sort of take a look at the puzzle and see where you and your family members might, really need some help, or maybe some of these changes coming up just aren't going to work out for you, you can let them know. And you can always get those questions answered by giving our folks here at Wyoming Senior Citizens Inc. a call. Of course, that number one more time is 307-856-6880. I wanted to thank you so much for joining me here today, Tisha. It's been wonderful.
My pleasure. Thanks for having me.
Today's show is brought to you by Porter's Mountain View Supply in Riverton. If grilling is part of your lifestyle, Porter's has got your back. Porter's carries quality grills built for flavor, performance, and durability. Whether you're cooking for a crowd or just firing it up on a weeknight, their team can help you find the grill that fits how you cook and how often you use it. Visit with Porter's team at 750 East Sunset Drive in Riverton, or give